Mm-mm-mm. All right. So in my group, we said, well, some of us, I was gonna do videos and stuff. I never got to it, but I'm gonna start doing them and I'll upload them. More like condensed, broad versions. I'd still do your own studying time. It's just to help you out. You had a long day. You don't feel like reading. You just listen to it. If it helps, it helps. If it doesn't, it doesn't. But going off from the beginning of chapter 8, this is part 1. I'm gonna finish this, go work out, come back, and do the rest of them, and we'll get it done. But infections and prevention, I won't get too deep into it. I think we all have a idea. If you studied an adult one, we just went over that. But let's start off with community and healthcare associated infection. It's in the word itself, community outside of the hospital, healthcare inside. Important notes that I wrote on there usually happens after 48 hours after admission. Most of these infections are drug resistant, and the most common one is MRSA. Prevention, hand washing, aseptic technique, and disinfectant. Aseptic technique has a more to do. It doesn't kill, it inhibits, and it deals more with living tissue. And disinfectant just kills the bacteria on non-living surfaces. Yep. And then you got your three on the slide. It was grouped into these three. The empiric therapy, but you pretty much give it before you know what the results were from the culture you got. Your definitive therapy, you got it, so you definitely know what you got to give. Your prophylactic therapy happens before infection, not happen before. Sorry, it prevents infection. Kind of got confused there, but it prevents infection. Now, responses: therapeutic versus subtherapeutic. Those are two simple ones. Therapeutic reduces symptoms. They're right there on the slide. Subtherapeutic, no improvement. Complications. In my way of understanding it, could be different. Correct me if I'm wrong, but you could do some critical thinking on this, and you could just say like, okay, does patient have allergies? Does patient take any other drugs that can affect them taking antibiotic? Stuff like that. You could maybe go into cultural ones. I don't know if there's any cultural ones. Just think outside the box. Think outside the box. Allergic reactions. That's a that could be how do you say it? A complication. We'll get into that as we go. Bactericidal kills bacteria. Bacteriostatic inhibits growth. Eventual death. Those are pretty simple terms like the intro. Then we get into the actual antibiotics. So first one, sulfonamides. I like to remember that this is a static one. It inhibits growth because of the S, sulfo, static. That helps me remember it. Then I have them listed. I won't read them just because I can't pronounce them. But what is the mechanism of action? It inhibits folic acid synthesis, which inhibits nucleic acid synthesis, and I think it was like purine or something like that. But it just inhibits the first step and then inhibits everything else. That's why it's a static, because it slows it down. Indications: respiratory infections, GI infections. A lot of this is also like outside sources that I was using, but I'm gonna leave this slide up there so y'all can like read it and get an idea. Excuse me. Okay. And also I did add the activity statements, and I just joined it all into one. So about why is it effective to UTIs? High concentration in urine, active against common urinary pathogens, works well in the urinary tract environment. And now adverse effects, they are separated. We got some from blood, skin, GI, hepatotoxicity, liver. And I'm gonna just leave it there. I won't get too deep into it. You can just memorize from that. If you do want the slides, let me know. I'll leave my number somewhere. I don't know. Anyways, nursing notes: take with 2 to 3 liters of water a day. Take with food, and monitor red blood cell count. Those are at the end of this slide presentation that we were given, but I just put it all into one. Makes it easier. Penicillins, 4 types: natural, penicillinase, amino, and extended spectrum. They're named right there. Won't get too into it, and also see their inhibitors. I would look at those and memorize those, or try to find a way to differentiate them. The way I, at the moment, try to tell the difference is when it comes to amino, they usually start with an A. On natural, there's only 2, not that hard to remember, G and V. I haven't found one for Sundays yet. Oh wait, I have actually. Most of them start with X, except not start with X, but there's an X in the actual name, except for nafcillin. But the extended spectrum I have not, and there's more on the slide. These are just very broad. I will look at that. How does it work? It inhibits cell wall synthesis. Now, although it says inhibits, this is a bactericidal because once it inhibits it, it kills. Indications, gram-positive. There's 3 listed on there. Not that many to remember. Adverse effects. There's different, I guess, mild, severe, but I'm just going with, from what I know from the top of my head, vomiting, diarrhea, abdominal pain, nausea. And then I will point this out though. I think it's important, avoid cephalosporins in patients with history of throat swelling or hives from penicillin. And also, it's not on here, but not all penicillin have the same suffix. It can be named completely different. So I take note of that, and I would also take note that sometimes they put the trade name instead of the actual name. I will look into that too. Interactions listed right there, even with some form of effect that it has on it. You can read it, or yeah, I guess I would say it just to listen. But NSAIDs, free penicillin levels, oral contraceptives. It decreases the effectiveness. Warfarin increases anticoagulant effect. Nursing notes: take with water and monitor for allergic reaction. You want to monitor that. I am allergic to penicillin, and we found out the hard way. Cephalosporins, 5 generations. This is very broad, but from memory, what I can remember is the first one. It works well with gram-positive, and prophylactic surgery is where it's used. Now, there are medications to all of these that I'm mentioning. They're all right there. I would look at it. Prophylaxis, yeah. See, I would look at it. What they do, what they're associated with. It's in the slides. They're just more broad. Second generation, positive as well, works with positive gram. It does work with some negative gram, not as good as others, but better than the first generation. Again, there are some medications not put there. Third, very great against negative, not so great against positive. Fourth, this will be 4 and 5 are more broader in terms of bacteria. They don't really specialize into one. But the fourth one, I do know that it works with UTIs, and the fifth one is a lot more broader, so MRSA, yeah. Adverse effects, I have them listed there: diarrhea, rash, edema, cross-sensitivity with other penicillins. Now, I also do remember, since they all kind of fall under the same, I guess, category, I forgot what it was called exactly, but because they do, even someone the allergic reactions can cross. That's what it says, cross sensitivity with penicillin, because they're kind of similar. But nursing notes, as you can see, it says penicillin allergy, give with food, no alcohol, no cerveza. Anyways, carbapenems. Personally, I think the most important thing is seizures, dosage related. Pay attention to that. And infused over 60 minutes, and it is used for cavity and connective tissue infections. And there are some listed on there. Do I have anything on this side of my notes? Nope. Next is macrolides. Yep, macrolides. Indications: strep throat, mild, mod respiratory infections, I can't pronounce that. Gonorrhea, chlamydia, mycoplasma. Adverse effects: GI upset. And then when it comes to these medications, it's which one. So GI upset is mostly related to erythromycin. Hepatotoxicity, liver, anorexia, flatulence. Now, how do these work? They inhibit protein synthesis, so these are bacteriostatic. But they can be cidal on high dosages. Now, nursing notes, highly protein bound, so these have many interactions. And we'll go to the last one. On this last one, I'll be honest, I did not study as much. There was a complication that happened, and it needed my attention, and I just got back. But I'm gonna leave the slide there. If you want the slides, I think I can leave a link. But I'll leave a link. Better than 50, 60 slides. If this helps. If I'm going too fast, let me know. And if I'm going too fast, there's a little you can monitor the speed instead of you could put in 0.75, 0.45. I'm really fast talker, but hopefully this helps some of y'all. Yeah. Have a good night.